Hello everyone. Today I wanted to talk a little more about female pelvic pain, cancer screening, and the uterus. As I mentioned before, my original inspiration for this entire art series came from when I was asked to give a presentation on chronic pelvic pain in women, and I was looking for a piece of cover art to help convey the message. Unfortunately, I didn't have anything handy at the time, but hopefully next time this comes up, I'll be ready. Female pelvic pain is extremely common. It often goes untreated and has a lot of different causes, or as we say in medicine, has a broad differential diagnosis. I thought a uterus would be a perfect organ to help depict this, as the pathology, or cause of disease, is often related to the uterus, and can also often be easily visualized. So it would give me a chance to try drawing a couple of abnormal findings instead of just artistically conveying them, like I tried to do for the series on mental health and the brain. I decided to include a uterine fibroid, or leiomyoma, as well as an endometrial polyp, as both are common causes of pain and/or irregular bleeding that I have encountered before in practice. Obviously that isn't exhaustive, and I'll try to touch on a few other important topics as well, and hopefully we can all learn to appreciate the uterus a little more, as it truly is a remarkable organ that we all owe a debt of gratitude for bringing us here. So in terms of the method for this piece, things were thankfully a little more straightforward this time. The shape wasn't as complicated, so I didn't bother using the grid method to outline anything, just a few lines to help with symmetry and spacing. I ended up just using a diagram of uterus as a quick reference as well, as the shape wasn't as complicated, but I still kind of have mixed feelings about whether or not I should have used a real cadaver specimen as a reference instead. I think the main issue I found is that a uterus in situ, meaning in place, or in a cadaver in this case, doesn't look quite like the standard mental image of a uterus everyone has, and it would be a bit harder to recognize, especially after adding the optical illusion effect. Additionally, the uterus can look like a lot of different things, depending on what parts you decide to include with it, and trying to add an internal view with abnormal findings could potentially be confusing, which would risk taking away from the message the art is trying to convey. I wanted the effect of the illusion to be stronger this time, so I tried making the lines closer together, which I think does augment the effect, but I ultimately ended up regretting it more than a little because it made it more challenging to draw. That being said, I do think once you see the final result, you'll find that the illusion is more pronounced this time, and even gives a little bit more of a 3D effect to the final piece as well. Dysmenorrhea, or period pain, is extremely common and occurs in a majority of women, usually without any other kind of disease or medical concern. That being said, it still really can be debilitating and uncomfortable, and it's one of the leading causes of absenteeism from work or school. Now, if you go to your family doctor and talk to them about period pain, one of the first things they'll likely talk to you about is trying some over-the-counter NSAIDs, or non-steroidal anti-inflammatory medications, like ibuprofen. I wanted to bring this up because I've definitely heard people talking before about how they have this really terrible period pain and how their doctor just told them to go home and take an ibuprofen, feeling like they were just being dismissed or their concern wasn't being taken seriously. And while I can't guarantee that wasn't the case, what I can say is that NSAIDs really are first-line therapy for period pain, and with good reason. The way NSAIDs work is by inhibiting molecules called cyclooxygenase, which go on to create prostaglandins, the molecules directly responsible for pain, inflammation, and uterine contractions. So when you're told to try taking an NSAID, it isn't just to help reduce pain, but it actually directly reduces the strength of the uterine contractions that are causing that period pain too. And for about 80% of people, that really is enough. They can be taken starting a day or so before the start of menses and during the first couple of days when prostaglandin levels are normally highest. However, if you are struggling with period pain, I would still strongly recommend meeting with your primary care doctor to discuss it so they can make sure you're taking appropriate doses, make sure you don't have any contraindications, and so they can follow up with alternatives if it doesn't help, and so they can help evaluate for any other possible causes of period pain as well if needed. Another common first-line treatment for period pain you'll often hear about are oral contraceptive pills, or OCPs. These can also be a great option that reduce pain while also potentially having some other beneficial side effects, like of course preventing unwanted pregnancy, or decreasing menstrual bleeding, increasing bone density, and even decreasing the risk of endometrial, ovarian, and colorectal cancers. However, there's a lot of nuance to this. When talking specifically about the combined type of OCPs, they are associated with a 50% risk reduction for endometrial cancer, with greater effects associated with longer use, while also being associated with a 20% decrease in risk of ovarian cancer for every 5 years of use. They've also been associated with an 18% risk reduction for colorectal cancer, although this effect was strongest for those with recent combined OCP use and wasn't changed by how long they were in use. Combined OCPs can help increase bone density in older women, however they can also decrease bone density slightly in younger women. Combined OCPs may also be associated with a small increase in risk of breast cancer. So again, all that to say this really is the kind of thing you should meet with your primary care doctor to discuss, so they can talk more about your personalized risk based on genetics, cancer history, risk of blood clots, and other factors. I'd also be remiss if I failed to shout out hormonal IUDs or intrauterine devices, which also do a phenomenal job of reducing period pain, often making periods stop altogether, while also preventing unwanted pregnancy for years at a time, without all the hassle of needing to remember to take a pill every day, which can prove to be surprisingly difficult for some patients. Now, there are a lot of other concerning medical conditions that can also cause pelvic pain or abnormal uterine bleeding, like endometriosis, polyps, fibroids, adenomyosis, pelvic inflammatory disease, and more. But that would be a lot to cover, and this isn't medical school, so let's just talk about fibroids for now. Leiomyomata, or uterine fibroids, are benign, meaning non-cancerous, not that they're nice to have. Growths made of smooth muscle, or muscle that you can't consciously contract. They're found in the uterus and can cause abnormal or excessive bleeding, pain, bowel or urinary changes, or nothing at all. They are very common, more common as you age, and can be found in up to 80% of women by the age of 50. Fibroids are one of those you didn't do anything wrong kind of medical diagnoses that lots of people get through no fault of their own. Although risk factors generally include things associated with an increased lifetime estrogen exposure, like obesity, never being pregnant, and starting periods before age 10. For patients without any symptoms, usually nothing needs to be done, as after menopause they will typically shrink on their own and not cause any problems. However, depending on the number of fibroids, where they are, or their size, they can cause a lot of problems, even affecting fertility. If they are causing problems, there are many things that can be done to help, including both medical and surgical options, depending on personal wishes and the severity of symptoms. Another topic I wanted to discuss was cervical cancer and cervical cancer screening. The United States Preventive Services Task Force, or USPSTF, gives a grade A recommendation for cervical cancer screening every 3 years with a pap smear for all women aged 21 to 29 years old, and recommends pap smear screening with high-risk HPV co-testing every 5 years in women 30 to 65 years old, with an important but uncommon caveat that certain people with increased risk might require more frequent screening. I feel very strongly about this, as cervical cancer can be really, truly terrible if left untreated, and can absolutely be fatal. It's one of those cancers that can progress really far without being noticed if it's not being screened for, as it can progress steadily for many years without any obvious symptoms. When I think of risk factors for cervical cancer, two things immediately come to mind: smoking and HPV. Smoking, of course, is a risk factor for all kinds of cancers. I know it's useless to say please don't smoke, but for those who don't smoke, please just don't start smoking. For those who do already smoke, please ask your doctor for help to quit. It will improve almost every aspect of your health. HPV, or human papillomavirus, is an interesting one. It's the same virus that causes warts. Warts, by the way, are all caused by HPV, not frogs or whatever other old wives' tale you may have heard of. There are lots of different types of HPV that are specific for different body parts, and you get infected when viral particles make it into any vulnerable or exposed areas of skin, like microcuts or scrapes or your mucous membranes. The way HPV works is that it infects the bottommost layer of skin cells, called the basal cells, and the virus develops as the skin layers slowly move upwards and transition to keratinocytes, or the outer layer of skin. As the virus grows, it disrupts these developing skin cells and causes these fleshy growths we call warts that can help spread viral particles. Warts can be hard to get rid of because they actually require killing this infected layer of cells way at the bottom of skin. I actually used to work in a microbiology lab that studied and helped pioneer the method for growing HPV, as it was extremely complicated due to the fact that the cycle of skin growing from the base layer and maturing to the outer layer of skin is a mandatory part of the viral life cycle, and that's really difficult to replicate. They eventually found a way to do it by growing skin rafts, these little floating bits of tissue from discarded foreskins from circumcised babies, which could be kept alive, allowing the virus to complete its full life cycle along with the skin, which is, of course, weird, crazy, fascinating stuff. I didn't personally grow any HPV or learn or contribute to the skin raft technique, but I did work on disinfection testing, including studies on what disinfectants could or could not work on HPV, as well as a handful of different bacteria as well. Anyway, HPV as a virus that disrupts the cell life cycle also has cancer-causing potential. But like I said, there are many types, like upwards of 200, and only a few are really high risk for cancer. For cervical cancer, these are HPV type 16 and 18, which account for about 70% of cases. The really great news is that we actually have an HPV vaccine that can help prevent cervical cancer. I mean, an anti-cancer vaccine. I really feel like people don't appreciate just how amazing that is. The standard recommendation is starting the series regardless of sex as early as 9 years old, though typically it starts between 11 and 12 years of age, with a catch-up period ranging up to 26 years of age. Although it can still be administered afterwards with shared decision-making with a doctor depending on personal risk factors. I think it's important to point out that the recommendation also includes males, as for one, genital warts are still not something anybody wants, but also because men can be asymptomatic and transmit the disease to women as well. I think one of the most common reasons I've seen pushback on the HPV vaccine is because HPV is a sexually transmitted disease, and kids and parents, especially if they may have a religious background, may not see why they need to bother if they're planning on being abstinent until marriage. And I really, truly do respect that, and I think that's wonderful for them. But I also know of a woman who died in, I believe it was her 40s, due to undiagnosed cervical cancer from that same kind of background. She was also religious, and she'd been completely abstinent before marriage and figured no vaccine or screening needed, as she lived a faithful, monogamous life. Her husband was also a great guy. He had grown up more or less without religion earlier in his life, and when he was younger, he had had a single sexual encounter with nothing else ever coming of it. He later found his faith, and then proceeded to live a devoted life, eventually marrying his wife who shared the same values as him. Unfortunately, what they didn't know was that during that one early encounter, he had contracted a high-risk variant of HPV, and he had become an asymptomatic carrier. After marriage, he transmitted the disease to his wife, and she developed cervical cancer that progressed for years before being caught. And tragically, she ended up passing away. And that's just not the type of thing I ever want to happen to anybody, okay? And I mean, again, bad things can happen. Unsuspected disloyalty in a relationship can happen, or sexual assault can happen, and disease can occur as a result. So please, really do take this seriously. I know that's a pretty heavy note to end on, but preventive health really is a matter of life and death. And I really do always try to cheer on and encourage my patients. But if they leave without being willing to talk or walk through things or really understand the risk, that really does hang heavy on my conscience, because I know and understand the kind of things that can happen, even if they don't or choose not to believe me. Well, everyone, here's the final result. Let me know what you think in the comments below. I do really think this one turned out pretty well, and I do think the illusion is a bit stronger this time around. Hopefully it makes you appreciate a little more what an amazing organ the uterus is. Hopefully it helps you take screening and prevention a little more seriously. And hopefully it helps you understand and empathize a little better with those suffering with pelvic pain.